I matched to the place where I first interviewed at. So
Oh,
that's a good thing.
great.
And yeah.
Hi everyone, this is Dikshit Chawla from Lexicon, the Indian magazine. And today we have a very special guest with us, Dr. Mannat, who matched into St. Peter's Hospital and University, New Jersey. So welcome Dr. Mannat and a huge congratulations to you for the match.
Thank you, Dikshit. Thank you for having me here.
Yeah, it's our pleasure for sure. And not to waste much of your time, I'll straightforwardly jump onto the questions. So my first question for you is like after the results came in, were you surprised to know where did you match and that did you already speculate you'll match there?
Honestly, I wasn't thinking where I'll match. I just wanted to match somewhere. So the first reaction was relief rather than, enjoyment. Oh, I matched to St. Peter's. I didn't know where I'll match. I thought I had equal chances almost everywhere that I interviewed at. So yes, it was a surprise.
Yeah, okay. And yeah, the journey is finally, the long journey is finally over now.
Yeah, that's a big relief. It has
Yeah,
been a very, very long journey.
right.
So more than happiness, I think the first feeling that most applicants would have is relief.
Relief for sure.
Yeah.
So talking of your journey, how long was your USMLE journey? And if you could just brief us about your timeline.
And I'm not sure when I started exactly, but like I had been thinking about going on this path since the second year. So it was in the back of my mind and subconsciously, I was somewhere preparing towards it. So I had started doing research towards the end of second year. I was involving myself in extracurricular activities, and that wasn't solely for the purpose of USMLE, because I am the kind of person who does enjoy, doing all this stuff since school times, public debates and competitions and all that stuff. But I had that in the back of my mind that I want to do this. So I actually started preparing for step one in 2019 when it was my internship year. So along with my internship, I started studying. And then I gave my exam in 2020. So I was supposed to give my exam in March, but then the first lockdown came, and then everything went downhill and my exam got cancelled. Yeah. So I gave my exam I managed to give my exam in June. After that, I prepared for step 2 CK, and then I gave my exam. Again, the same scenario. Again, my exam was scheduled for March 2021, and then it got cancelled. And again, I gave it in June. So yeah, 2021, I gave my step 2 CK. So around June. So I had extended my internship for that 1 year, and I had to extend for a lot longer than I had initially planned because of COVID. And because I had applied for electives, but none of them worked out. Because of COVID, all of them got cancelled. So I finally finished my internship just before giving my step 2 CK. So like 15 days before, I was doing my labor room and maternity duties in college, and then I went and gave step 2 CK. After that, around July, I gave my OET, July end, and then I went for rotations up just before the application deadline.
Right.
So after that, yeah, it's been like just giving interviews and preparing the application in between, and then finally the match day this year.
Yes. So talking of your prep, like a major chunk of your CV like matter, and the scores of course matter a lot. So how are your step 1 and step 2 CK scores like?
Far from fabulous. My step 1, step 2 CK scores were very average, like around 230s. And I actually had a drop also in step 2 CK from step 1.
Yeah.
Because I don't know, because I was probably anxious and a lot of, internship duties, and I just didn't perform well on test day. Yeah, but I didn't let that thing get to me, or like people say, okay, if you have one low score, then impossible for you to match.
So like talking of the pathways again, which pathway did you specifically take?
I went through pathway 1. I think that's what most of us would do, because pathway 1 requires you to have a license to practice here.
Yeah.
And I got my degree in June 2021, and then I applied for Pathway 1.
Great. So, Doctor, as we know that Step 2 CS is now cancelled and it's replaced by OET, which is still persisting in the cycle of 2023. So, what's the best time according to you to take the OET exam, and did you specifically spare separate time to prepare for it, or how was it like, the OET?
See, honestly, it depends. Like, what is your level of English? So this answer would vary for everyone. I
Yeah.
would just say book your OET as soon as possible, especially for people who are applying to this match. You should start booking your OET right now, because my OET got postponed 3 times and there are only 2 dates available per month.
Yeah.
Yeah. And OET is required for approval of pathway. Regardless of which pathway you take, you need the OET exam. And
Okay.
with 2 dates per month, they get filled up very quickly. So you need to act fast and just book it as soon as possible. Also, regarding the preparation, I personally took just 1 week, 1 to 2 weeks. So 1 week, I just got into the feel of the exam, just looking at the pattern and the structure and what kind of questions are there.
Yeah.
And last 1 week, I just practiced some letters. I practiced some speaking tests with a partner, study partner I found online. So we used to practice speaking together.
Yeah.
And then a writing part, I practiced some letters. I just wrote them down, because if you're good in English, if you've been writing passages in school and reading sections and if you're doing all that stuff, you
Yeah.
just need to know the pattern of the exam and time management. You need to learn time management. So that's the most important thing. So I would say 1 to 2 weeks are more than enough for most people. But if you feel that you're not good in English, you can take 1 month.
Oh.
So there are certain resources out there on Facebook groups, Reddit, wherever you go. There are a lot of sources. You can approach those and take out practice tests. There are practice sample cards. Most of the people fail in the speaking portion and the writing portion. And now for 2023 onwards, they've actually reduced the cutoff. So
yeah, actually,
I think from 350, they've turned it to 300, which is a good thing, because writing is the most difficult part.
Okay, great. So as we have heard how COVID actually impacted on your USMLE journey, and it was really difficult in that time to get USCs. So how are your USCs like? And if you could just share your experiences with us and the preferred amount of USCs an applicant should have.
Again, there's no fixed number. I would say as much as possible. I personally tried a lot to get electives. I started looking at them early, but nothing worked out because of COVID. So for 2 years, I think 2020, 2021, nothing at all was open. No hospitals were accepting students. So I just managed to, grab outpatient USC. So like all 3 of my rotations were in clinics, private clinics, which were not exactly affiliated with some hospital, but the physicians whom I worked under, they were affiliated with one or the other hospital. So I did 3 rotations, and I got my LORs on the hospital letterhead of the place where they were associated with. So they were good. I feel that they were externships because I did them after graduation. So they were called externships. And they were pretty hands-on. I learned how to, operate the EMR. I actually understood all those things about insurance policies and billing codes and the things we read about for Step 2 CK. I actually started gaining knowledge of them while I was doing a rotation.
Yeah.
So as long as you're gaining all those skills, you know how to take a presentation, you know how to take a history, how to talk to them, the cultural differences that are there, you know how to operate the EMR. So I think those skills would really be helpful while talking about your USC in interviews. So even if you're not getting hospital rotations, make sure that you choose a rotation, an outpatient rotation that has all this available. Like they let you operate the EMR and they let you see patients, they let you present cases. And again, like you meet a lot of people, you meet other students and you exchange stories and tips. And so it's a good experience. Yeah, it's a good experience. About the amount of USC, as much as possible. Like if you've done 6 months, that's obviously better than doing 2 months. I mean, ultimately you need 4 LORs to upload.
Yeah,
but
okay.
you have a section in eras which is the work experience,
Hmm.
and you can write down about all your USC there. And even some programs, especially in specialties like family medicine, they have cutoffs. So they require at least 3 months, some require at least 6 months of USC, some even require at least 1 year of USC. So we are
Oh,
automatically, like we automatically eliminate those programs while applying.
exactly.
So so it's always beneficial to have some kind of USC.
Yeah, right. Now, if we talk about some competitive specialty like surgery or radiology, research matters a lot, of course. So, did you
Yeah.
manage to get any research position, or how, like, did you publish any papers in med school? And what suggestion do you have for applicants if they're interested in research?
If you're interested in a competitive field like competitive ones like radiology or surgery, you need a lot of papers. So I personally know somebody who had 19 to 20 papers, and then she
Great.
managed into general surgery and radio. Yeah. So you need a lot of papers for that. For internal medicine, family medicine, it's not a deal breaker, but it definitely gives you an edge if comparing applicants who have similar credentials as you. So it's always better, especially if you're applying to competitive universities like Cook County, Jacoby. Like if you want to match into some good hospitals, you do
Yeah,
need research.
right.
So I started in, I think second year was the time, 2016. I think I attended my first conference that was in Lucknow.
Okay.
And yeah, that was an eye-opening experience that actually got me interested into research. If you're in med school and you have no idea, just approach some teachers who are into this stuff, like
Hmm.
who have knowledge about this, or you can just look up online on your college website and
Yeah,
just check which all teachers have papers published in their name.
right.
And you can just approach them that just approach them with the topic you have in mind, and
Hmm.
just ask them that you're interested in doing a paper, and they'll help you. So that's where how you start writing a paper. So you can start with original research, or you can do narrative reviews, so it's up to you, or even case reports, but like they are at the lowest level of evidence.
Yeah,
But it doesn't matter. At the end of the day, any kind of research you do, any kind of, even online public, like the articles we write for Lexicon. So I
yeah.
had 6 to 7 articles till the time of application. So I included all those,
Great.
because there's a section in your ERAS application where you can link all the articles that you have online.
Okay.
So that's a separate section from your publication. So I had four publications. I had lexicon articles, and I didn't have a remote research kind of experience like research volunteer, but I had done some research mentoring in my college, like
Yeah.
in third, fourth year under MSCI and all that stuff. So I had a decent enough research experience to, yeah, talk about. So I think that might have helped. It may not have helped. So I don't know, because I
Yeah.
was asked about it in one
Okay.
or two of my interviews. I was asked about my research experience. So they did read it, but I don't know how much value does it carry for internal medicine. So
Oh, right, right. Okay, so coming on to my next question, like when we talk about med school, like someone has decided that they want to pursue Emily so bad, but should be the ideal mindset, or what resources should they be using in the med school along with the resources that preferred by the med schools? Like the golden resources are always there. Like what resources you used along with your studies?
very confused initially. We knew three or four seniors in our college who had matched, so we
Yeah.
didn't have enough guidance. So it was just trial and error. I took up Kaplan, and when I was studying neuronat, I think third year, second year, or third year, I just did some neuronat from Kaplan, some physiology, and then I left it. I didn't do anything. Then third year, I did some Pithoma. I think Pithoma has to be done. If you're in third year and you want to pursue this path, just do
Yeah.
Pithoma at least
Okay.
once. Yeah, because that book is golden for pathology, and you need to do it as many times as you can. So I watched Pathoma videos in third year along with my path. And for micro, if you have time in third year, you can do sketchy. You can start doing sketchy alongside.
That's great resource actually.
Yeah, yeah, I love sketchy. And honestly, nobody does it for pharma, but like during the end of my prep, I even watched sketchy farm, because I didn't study enough in second year. like they say, second year is the honeymoon period.
Honeymoon
And,
period.
1.5 years. It used to be. I don't think it is there now with the changed curriculum.
Yeah, it's 9 months
But
now.
yeah. So it used to be like 1.5 year during my time, and I literally just enjoyed. And my pharma was weak by the time I was in USMLE prep time. So I had
Yeah,
to work on my farm, and USMLE, like Sketchy Farm, actually really helped me. So I would say Sketchy is a really good resource. And
yeah,
other than that, there are a lot of resources. So now people use Boards and Beyonds. I don't think people use Kaplan anymore. We used to use Kaplan, but I always thought that it was not of much use except for biochemistry or some subjects like immunology.
yeah. Kaplan
Mostly
actually
you
has
don't rely on
really
that
great
information.
biochemistry, especially Dr. Sam Turku.
Yeah. Yeah, Turco lectures. They are really good. Like you have to watch Kaplan biochemistry. But I didn't do Boards and Beyond, but I've heard like that's the go-to resource now.
Yeah,
And
right.
so there are a lot of resources. So there's physio. You can incorporate that into your studying. It all depends on how dedicated you are
Yeah,
towards studying, and like how much time do you have, what is your capacity, if you can manage prof exams along with step. So just
exactly.
get it done in third year. Yeah, get it. You can get it done in third year, especially since it's pass fail now.
Yeah, right.
And yeah, but on
Plus,
the other hand, like people say, okay, it's pass fail, so you don't need to study for it. But actually, your base building would be by step one. So you actually
right.
need to study hard for step one as well if you want to ace step two, because a lot of concepts are intermingled.
Yeah. Just talking of resources, not to get confused by these plethora of resources available online. You'll end up being more
Yeah,
confused ultimately.
yeah, true. I would also say that just decide what works for you, keep it
Yeah.
minimal, 4 to 5 resources, and just master them. Obviously, UWorld is the, like they say, UFAB. So there's
You
a
have
UWorld FA,
first year
Pathoma,
and
and then you can
diploma.
add Sketchy and Boards and Beyond.
Right.
So all these resources, just keep it to that. There are a lot of other resources, BRS, physiology, and all. Like there's a lot of resources. So just keep it
Yeah.
minimal and just try to master those.
Right. So now, Dr. Mannat, everything is done. You have step scores, you have research. Now coming on to the interviews. How did you nail your interview? How were they like? How was the
My
experience?
interviews were very nice. Like I was only nervous for my first interview. Like I
Uh,
prepared a lot for that. Like not in a lot in the sense like mentally I prepared a lot. Like
yeah.
how would it be? What would be the experience? I don't, because initial months I just got 1 or 2 interviews in the initial month.
Okay.
Like for 2 months together, I just had 2 interviews, and I was freaking out. Like, what if I don't get more interviews? So
Yeah.
I just wanted to do my best in those. You just read the most common questions that are circulating around, but also everybody says not to be repetitive, which is actually true, because by the time your fourth or fifth interview rolls in and you're answering the same questions and like
Exactly.
giving the same answers, it starts sounding artificial.
Doesn't make sense. Yeah.
Yeah. So just prepare. I just prepared the top 3 or 4 questions, the most common questions, like why that program, why the specialty, and then the rest of it I went with the flow, and
Yeah.
it
And
was really enjoyable. Yeah, it was really like each of my interviews, they were really enjoyable. They approximately lasted for 2 to 3 hours.
hmm.
Some were One of them was I think 5 hours, but that most of the time also includes orientation and
Yeah.
all that stuff.
Right.
Yeah, but like I wasn't asked any medical questions. We mostly talked about my hobbies and my experiences and the city. So it was all basic stuff. And some interviews they ask you behavioral questions as well.
Right.
So some of them are a bit tricky, but like if you actually prepare 1 or 2 of them, you can nail them. I,
Great.
I I would just say just be confident and just know your application in and out. And I actually believe that if you honestly done all the stuff that you've mentioned in
Exactly.
in your application, and you've written your personal statement yourself, your story, then
Mhm.
it'll be very easy to talk in interviews, because you're just talking about what you have done and
Yeah.
who you are and what are your hobbies. So it's just all about you. So you don't need to prepare for that stuff. You just need to prepare for which program that you're interviewing at. You just need to research about that program so that you can talk about that program specifically and that specialty. So there are 2 or 3 answers that you need to prepare. but the rest of it just flows. So just be natural and just enjoy the process, because interviews are actually enjoyable, like if you don't stress about it. And I realized that later into the interview season, because the first one I was really freaked out.
Yeah. Plus, I'd again like to emphasize on honesty. Like the people out there are on a whole new different level. And if you flex some fake things, they'll catch you, of course.
Yeah. And you actually have to make a connection with the person who is interviewing you. So
exactly,
just actually understand what he's trying to say and just ask follow-up questions so that you can show interest, and you actually have to be involved genuinely. And I matched to the place where I first interviewed at, so that's a good thing. And yeah.
Yeah, right. So moving on to my next question is connections. Everyone says you go to a conference, make connections. You do USC, you make connections. You do research, you make connections. So how important is this connection thingy, and how did you manage to make some like vital connections during your US visits?
Connections are important. I would say, like, that didn't really help in my case, not a lot. I had seniors who would guide me, and I had one or two seniors in one of the programs I got interviews at. But ultimately, unless you have a very strong connection, if you like somebody who is mentoring you, I don't think they really help. So connections in the sense that, okay, you met somebody at a conference, he really liked your work, okay, he's a professor, you just take his email and then keep sending him updates via email occasionally. Just keep him updated about your life. And then when it comes time for the interview season before application, you can just tell him, okay, if you really like my work, or if would you be willing to put in a word for me, or so that's how you can make those connections work. So as many as you have, they do actually matter. Even if you have mediocre scores and you have very strong connections, it would work for you. But you actually have to be proactive to make it. Even during rotations, people who you are meeting, stay in touch with your seniors, the alumni network from your college, and approach. I was given this advice by one of my seniors that go all out during interview season.
You have to sell yourself.
Approach anybody who you remember, like who can help you. And you never know, something may work, something may not work. So, and also, even after somebody recommends you for an interview, at the end of the day, it depends on your application and your interview performance. So they can't really help you match. They can help your application being seen by the program, because full of so many applicants, 5,000 to 7,000 applications they receive every year. If somebody is vouching for you, then it helps in making your application. Unless you have very strong connection, somebody is your uncle or aunt or father, mother, sister, husband, wife, whatever. Yeah, that sort of connection, that's next level. You can't beat that.
Yeah. So now, as I expect you'll be going to the US soon and starting your new phase of journey. So why actually US? Why residency in US over India?
So I had to answer this in so many of my interviews. So when I started, I didn't have any idea why I wanted to go to US. My cousins are in US, and I just knew I wanted to be in US. There was no fixed reason, but I always used to complain about how the system, I don't like the system or something, all those things, better technology, better advancement. Ultimately, it's about working in a setting where you meet so many people, culturally different people. That's also something that I really like, because I like to read, and I enjoy talking to different people from different cultures, all that thing. So that's also something that really excited me about going to the US. So there were a lot of reasons, but there was not one specific reason why US. It was just something I really wanted to do, because of I always thought it would be better system wise, because ultimately you get really good doctors from India as well. It's a personal choice. Because there are pros and cons of both the systems, the Indian system, US healthcare system. It's what you want in your life, no particular reason.
So now coming on to my last question. So many of them matched, so many of them didn't match. So what's your piece of advice for the ones who were not able to match in this cycle?
So if you didn't match, introspect firstly. and like look at your application. Do you think something was missing? There could be a lot of factors. Maybe you were not ECFMG certified on time, maybe your application was incomplete, or maybe your interview performance wasn't good, or you didn't have enough USC. So there could be a lot of reasons, and it could be just purely luck as well. Maybe it's not the time for you. So don't lose heart and work even harder. If you've not given step 3, give step 3 before the next application cycle, and gain more USC, gain more connections. You can even take up a research position if that's feasible, because not everybody can live in the US for so many months on an unpaid research. So you can take a remote research, but like don't give up. And just if your application was not well versed or not well written, because that's a reason a lot of times. So just like show it to people you meet at your rotation, some supervisor attending, people who actually live in the US, because we have a very different system of writing and grammar from our US counterparts. So it's always better to have your application reviewed by somebody who has matched, either who has matched, who is a resident there, or like somebody who has good native English. Like it could be anybody you know in America, because they have a different system, they have different spellings, they have different way of writing stuff. So always have your application reviewed by at least 4 people, like not a lot of people, because that also spoils it. Too many opinions.
Give their input and you have to edit.
Yeah. So 3 to 4 people that you trust.
Right. I think we're done with the questions and it's finally time to wrap up, Doctor. It was such a great time interviewing you, and thank you again for sparing out this crucial time of yours for this interview. And I hope a lot of MLE aspirants will be inspired by those words. And thank you once again for joining.
Thank you so much for having me. And I would also like to thank Lexicon, because I've been associated with Lexicon since 2017, and it has helped me a lot in my journey. It has improved my writing skills so much that I was asked about it in all of my interviews, and it formed a major chunk of my application. Holding different positions in Lexicon, because I was from a columnist, I was a social media manager, then creative head. So I directed an edition. So all this really helped. And even if I wasn't applying, I think I would have joined Lexicon just for the sake of learning skills like lead communication and teamwork and just writing. So I would really like to thank Lexicon for it, and just keep doing what you are doing.
Yeah, the feelings are mutual, and thank you once again, and wish you luck for your future. Thank you, Doctor.
Thank you, Dikshit.